Afternoon. Welcome to today's Wisconsin Health News virtual panel on what's next for healthcare in Western Wisconsin. My name is Tim Stum. I'm the editor of Wisconsin Health News. Thanks to all of you for tuning in. We have a really great panel with us today. I am thrilled to introduce Dr. Richard Helmers, Regional Vice President for Mayo Clinic Health System, Wisconsin, Dr. Brian Hoerneman, President and CEO of the Marshfield Clinic Region of Sanford Health, Senator Jesse James, Mike Sanders, CEO of the Chippewa Valley Cooperative Hospital, Senator Jeff Smith, Jason Troxell, Northwest Wisconsin Division President for Aspirus Health, and Sean Kirkby, Senior Editor of Wisconsin Health News, who is moderating today's event. Before we get started, though, I want to make sure we thank our very generous sponsors of the Wisconsin Health News virtual series. Healthcare leaders from across the state sign up to watch these virtual events, and they would not be possible without the generous support of our sponsors. So a huge thank you to Aurora Healthcare, AARP Wisconsin, Anthem Blue Cross and Blue Shield of Wisconsin, Delta Dental of Wisconsin, Emplify Health, RSM, and Quartz. Wisconsin Health News is an online, nonpartisan news service. In addition to hosting events like these, we also publish a daily email newsletter. If you're not yet a subscriber, I encourage you to sign up for a free trial, which you can do on our website at wisconsinhealthnews.com. And I want to give an extra thanks today to RSM, today's featured sponsor. We are very grateful for their generous support. Here to say a few words is Danny Schmidt, a healthcare senior manager for RSM.
All right. Well, thank you, Tim, and good afternoon, everyone. My name is Danny Schmidt, and I'm a healthcare industry senior analyst and senior manager aligned to RSM's healthcare practice. And for those who don't know who RSM is, we're the fifth largest CPA firm in the nation, and we are the leading professional services firm to organizations in the middle market. And to briefly describe that, that's organizations with top-line revenue of roughly 50 million to about 10 billion. So that's a substantial portion of what occurs in the economy today and is representative of the panelists today. So we're a proud sponsor of Wisconsin Health News, and we thank Tim for allowing us to be here and sponsor this panel. This topic, it's very important and is one of the challenges that many organizations face. And so with that, again, RSM, we appreciate everyone's time today. We appreciate WHN's ability to curate a best-in-class panel with healthcare executives like these individuals today who are leading the charge on this important topic. So again, thank you, and back to you, Tim.
Thank you, Danny, and thanks again to RSM for all the generous support. With that, I'm going to hand it over to Sean to lead today's discussion.
Thanks, Tim. In spring 2024, hospitals run by Hospital Sisters Health System in Eau Claire and Chippewa Falls shut their doors, sending shockwaves throughout Western Wisconsin. Since then, providers have stepped up services and pursued building projects to meet community needs. Our panel is going to take a deep dive into what's happened. And Senator Smith, I'd like to start with you. You represent the two cities that lost their hospitals. What impact has this had on your constituents?
Huge impact, Sean. We were all shocked, and I know Senator James and I both. We were informed the day of, basically, that the announcement became public to everyone else. But it put us in a position of scrambling to figure out how we were going to alleviate or even make it an easier transition for everybody. Of course, both hospitals, and Sacred Heart especially in Eau Claire was the largest of the two, but had been there for 125 years. And so for many of my constituents, absolutely, it made a big difference. We had 700, from an average of over 700 births at Sacred Heart Hospital alone. And that meant that many people who are already planning to have their baby in Sacred Heart had to find some other place to do that. It made a big difference, for instance, at St. Joe's. I know they have had a lot of what do I want to say, kidney dialysis going from there, and it made that much more dangerous situation for many who had to travel much further to be able to get to their dialysis treatments. So it was a huge impact. It was a shock. I know even people were angry about the whole thing, and I understand how the limited amount of time that the patients had to be able to make that transition made it even harder.
Thanks, Senator Smith. Senator James, can you talk a little bit about the impact across Western Wisconsin, your district border, Senator Smith's? What impacts have your constituents seen from this?
Well, thank you for having me on the panel today. I appreciate it. And yeah, this impacted the Chippewa Valley region dramatically. The issues that we had with not well, when this all first started, I want to start out by saying that the number one issue that we were being told by the professionals was the explosion that they were going to see when it came to emergency department visits, emergency room visits. And that's when the initial discussions started taking place where we needed to really educate our people back at home and the difference between urgent care and emergency room visits, trying to absorb some of that overflow that was going to take place, the overcapacity. And sadly, it still exists today. So that issue still exists. That was our number one issue that we were looking at as legislators, first and foremost. But the impacts with surgeries, with any type of, well, we lost our county morgue in Eau Claire. HSHS Sacred Heart had Eau Claire services for our law enforcement officers, to include myself, for legal blood draws to take place. We lost the birthing capabilities. We lost AODA services. We lost mental health services. There is every single impact that you can think of that the hospitals served in their capacity was impacted by the loss of Sacred Heart and St. Joe's. Not only when in the definition of the Chippewa Valley is Eau Claire, Chippewa, and done, but it far did more dramatic outreach with our surrounding counties, with everywhere across northwest central Wisconsin.
Thanks, Senator James. Dr. Helmers, in the year and a half that these hospitals have been closed, what impact has this had on your operations? What have you seen from in terms of increased demand on your facilities?
No, thank you, and thank you for having this panel today. What we've seen in our Eau Claire facility is approximately about a 30 to 35% increase in things like emergency room visits, trauma visits, demand for primary care, kind of overall appointments. So overall, I would say that we've seen an approximately a 30 to 35% increase in those various things that were related to that. And I'd say, predominantly the major impacts have been on the emergency room, trauma services, primary care, and then other specialty services that are associated with that.
Thanks, Doctor. Dr. Hoerneman, what about you? Is that what you've also seen in Marshfield?
Yeah, along those same lines, and actually very similar numbers to what Dr. Helmers referenced from the emergency department volumes. We saw an increase of about 30 to 35%, and we're able to accommodate that. The area there we saw perhaps the most impact was, as Senator Smith had noted, where those expected mothers needed to deliver. And we had to rapidly step in and expand our capacity to make sure that we could provide that care. That was, as Senator Smith had mentioned, there was not much lead time. So we asked our Eau Claire team to jump into action and planned for that. So they took some available space. They built out the new women's health suite, and they've seen their labor and delivery capacity gone up now 300%. So seeing significant increased volume in labor and delivery. Also seen increase in primary care. We expanded access also to oncology, so patients aren't having to travel for their cancer care, radiation oncology as well. And we opened up two new urgent cares, one in Lake Hallie to provide some additional access for unscheduled care up in that region. And then our Oakwood Clinic also opened up an urgent care. So working to replace some of that safety net services, some of those safety net services that were left in the lurch as those hospitals quickly exited the market. And we've taken a methodical approach to being able to fill those in, and we'll continue to assess what the needs are and meet those as we go forward.
Thanks, Doctor. Mike, the Chippewa Valley Health Cooperative, which formed in response to these closures, has opened a cancer center in St. Joseph's, the hospital that formerly served Chippewa Falls. Can you talk a little bit about the need for cancer care in this region?
Sure. And maybe if I can just take a minute to just talk about the cooperative, how we
Sure.
got started before we get into that. And, the senators have both adequately described the crisis that occurred last spring, and it left about 1/3 of the capacity of the region closed. And the cooperative grew out of a group of citizens, community leaders, business leaders, with some input from physicians to try to create some options. We had over 100 physicians who lost access to hospitals and hospital privileges. And our goal was to replace that capacity. So we are a cooperative, locally governed.
It looks like we might have lost Mike there. Oh, I think he's coming back on. The joys of working with Zoom. Um,
Can you hear me now?
yes, Mike.
Yeah, sorry. So we've grown from out of the ashes almost to more than 1,400 members. We are a nonprofit organization focused on recreating some of this capacity that's been lost. And our friends at Sanford and Mayo have done a great job trying to meet the need. But there's not enough physical capacity. We hear stories every day of people still driving long distances for care and long wait times for access and ERs and ambulance garages. So while there's been effort to address some of this, it just hasn't been enough. So we're trying to fix. I'm going to do a mic test here because I see people frozen.
We can hear you, Mike. You look like you're a little bit frozen, but you're coming through.
I'll just keep going then. So we've raised over $13 million to help address the needs here. And then in July of this year, we were able to acquire the closed
Yeah, it looks like we might have lost Mike again. My apologies on this. I think he's kind of getting back on right now. Mike, can you hear us?
Yes. So we're working to reopen the hospital next late summer is our goal with a full range of community services, OB, cardiology, cancer care, inpatient ER, basically recreate a community hospital here. And the cancer center, the cancer issues were immediate when the Prevea Cancer Center closed in Eau Claire last spring. Several hundred patients were caught without care or had to transfer care. And it was a major impact on families and caregivers. And so we're excited that last month we were able to open medical oncology services at the hospital. And we've seen tremendous patient growth there just in a few weeks as access to services for people that have had to go out of town. Because while our colleagues in the area have expanded capacity, there's still a lack of access locally. So we're trying to address those things that we can do quickly as soon as we can. The hospital opening won't be till next fall because a key driver in that is having electronic medical record. So we're working on implementing an Epic system there, but the lead time on that is about 12 months. So we're a few months in on that. So that's kind of our timeline. Sorry for the glitches. Hopefully we'll be okay from here.
Yeah, it looks like you're coming in pretty clear right now, Mike. So thank you. Jason, could you talk a little bit about Aspirus Health and their interest in this market? This is a new market for you all in Chippewa Falls. What have you kind of assessed as the region's healthcare needs?
Yes, so good afternoon, everyone. I'm Jason with Aspirus. So Aspirus Health is 17 hospital health system in 3 states, central Wisconsin down to southern Wisconsin up to northern Wisconsin. into the UP of Michigan and into Minnesota. As we looked at the Chippewa Valley market, we operate a hospital and clinic fairly close to that market, about 20 minutes from that market in the Stanley facility location. And we knew that there is, obviously there's a number of players in the market with 3 or 4 health systems before HSHS closed. But once HSHS closed, we saw the great need for care for patients within that community. Aspirus actually launched its own initiative during that time called No Regrets, where we expanded access to our beds at a number of our health system hospitals in order to care for the surge of patients that might come our way with the closing of those 2 facilities in the Chippewa Valley. And as we assessed the market and looked at the market, we really wanted to focus on 2 things. One is, how can we provide the most critical care needed at the time with the closing of those 2 facilities, and how can we provide that with speed? So we decided to open our own facility in the Chippewa Falls area that will meet those critical needs of what we assessed was emergency care. As the senators had mentioned earlier, there was a great need for emergency care with the closing of those 2 hospitals. Primary care, the need for more primary care providers in that region, and then inpatient care. So our facility that will be opening here in 2026 around September, we plan to meet those critical needs and try to meet it with speed, which is what we're working on, is to get that facility open as quickly as possible.
Thanks, Jason. I'd like to take a little bit of a deep dive with you and Aspirus' work for a few moments, and maybe go through the panelists to do a little bit of a deep dive too. Can you talk a little bit about your decision to open a micro hospital in the area? This is about a 10-bed facility, correct? Why that as opposed to a larger facility?
Yeah, two reasons and a third reason. So the 2 I kind of mentioned already was we wanted to hit the critical needs of the community. And so we saw the critical needs of the community, as many of the panelists already mentioned, was emergency care. So emergency care was needed heavily with the 2 HSHS facilities closing. Many patients had to travel 30 minutes just to get to an emergency department, and then had to wait longer because there was such a surge of emergency care needs at the existing facilities that were still in the valley. So we wanted to hit emergency care and provide that to the community. Primary care was the other critical need, and then inpatient care. But we also wanted to provide it with speed. If we were to build a 60-bed hospital or larger, it would be hundreds of millions of dollars, and it would take a large amount of much longer time to actually build that, as well as provide the staffing for that and the providers for that to open that facility. So to meet the speed to the community and provide the care that we saw that was the most critical, this made the most sense to us. And also we wanted to be financially responsible, if you will, and be able to have that facility be sustainable very quickly. An investment of a much larger facility would take a lot longer for that investment to actually begin to break even. And so there was a danger of that being sustainable into the future. So we're stepping into the market, have awareness of the market because of our location about 20 minutes away in Stanley, and meeting the critical needs as fast as possible with a sustainability and a financial approach as well that we feel is will be successful into the future.
Are there plans to, or an ability to potentially scale this facility in the future, and what would that look like?
Absolutely. In fact, as we did our plans for this facility, we have phases in mind in scaling the facility. So we're opening phase 1, as I mentioned earlier, with the ED, primary care, and inpatient services. We're designing the building as well as where the parking lots are, where the driveways are, so that we can expand the facility rather quickly if we need to. We can double it rather quickly if we need to. Add additional beds, add a bed tower, add additional services, double the size of our clinic. But that's not our approach day one. Our approach day one is meet those immediate needs, meet them with speed, and have the ability to scale as soon as we need to, so that we can flip to scaling if we see that our volumes are increasing and we need to scale the facility. We can do that rather quickly. So that's kind of our approach. So as you mentioned plans to scale. We have it planned out in phases, but we're going to do that based on our volumes and based on what we see in the community as we step into it next year.
When it comes to hiring for this facility, have you begun hiring already? How there's, a number of healthcare workforce shortages out there. How are you planning to meet the need for workers?
Sure. We have already begun interviewing a number of providers, so ED providers as well as primary providers, primary care providers. So that's ongoing. In fact, we have interviews tomorrow and next week. We haven't issued or hired any providers yet, but we are well underway in that process. For staffing, we will begin that process of posting positions and interviewing for positions after the holidays is our plan. And we expect to fill those positions before we open in September of 26. As for healthcare staff in the community, when HSHS closed, we actually hired a great number of them at our Stanley facility as well as our other Aspirus facilities, and probably the same is true for Mayo and Marshfield and the other health systems in the area. But we do believe we can fill those positions. Our Stanley facility essentially has all of our positions filled as well as all of our providers filled. So we have success in recruiting for positions for providers as well as for staff. But we expect to start hiring here after the holidays for staff.
How many folks will the hospital employ?
The hospital employ between 50 and 100 staff members that employ ED physicians and primary care physicians. And then there will be system physicians that actually support the hospital as well. So if you think about finance, rev cycle, IT, HR, quality, many of those positions won't be located in Chippewa Falls, but will support the hospital also.
Thanks, Jason. Dr. Helmers, can you talk about the steps that Mayo has taken since these closures? What services have you stepped up?
Sure, thank you. So I mentioned at the beginning of our discussion that over the last year and a half, the two Mayo Clinic Health System regions in Wisconsin have merged so that we have the hub hospitals in Eau Claire and La Crosse, and then 5 critical access hospitals, Barron, Bloomer, Osseo, Menominee, then also Sparta. One of the things that we did at the onset of this is we set up a hospital and emergency room command center that's here in our Eau Claire hospital. And it's staffed by a hospitalist physician, emergency room physician, several nurses. And in the command center, we have the 7 screens of the 7 emergency rooms and the 7 inpatient units throughout the state so that that group acts as to determine, put the right patient in the right hospital of the 7 hospitals we have. We do have to, thank our colleagues in La Crosse because every day we have some Eau Claire patients that have been hospitalized in La Crosse because our Eau Claire hospital is typically at capacity. So one of the big things that we've done in order to maximize inpatient care for patients at Western Wisconsin is our command center. Also, at about that time was when Mayo Clinic Health System launched a primary care on demand feature so that all patients that can access primary care physicians 24/7 through a video capability. So the primary care on demand, we developed the command center. We have through the 5 critical access hospitals increased our critical access hospital capacity by 20 beds. We increased our inpatient behavioral unit by 8 beds. We remodeled an old unit here in Luther Hospital that creates 17 what we call transitional beds for patients that need to be hospitalized not for a great length of time. So if we talk about the transitional beds, the additional beds to the inpatient behavioral health unit, the additional 20 beds to our critical access hospitals, the Wisconsin Command Center, and the primary care on demand are the predominant things that we've done to expand our ability to care for patients during this time.
You mentioned that the Eau Claire Hospital ED is often at capacity. Are you planning to expand that in the future at all?
So we're certainly looking at that. We're continually looking at what our space needs and capacity are. So that's something I would say at this point is just really under careful examination and consideration.
When it comes to building up your workforce to handle this, can you talk a little bit about how you've expanded in this area? How many folks from HSHS have you brought on?
I don't know the exact number from HSHS. We've hired probably an additional 200 250 people to our practice since that time. Not sure exactly where they all came from, but we've expanded our staff by probably 200 250 people.
And when it comes to like the financial impact on your system, I mean, what have you seen? Has this been a hard hit to your finances at all, or have you seen revenues go up because of this?
Probably the latter, as we've been significantly busier and had significantly more surgical patients and trauma patients and that sort of thing. And as we're at capacity, that certainly our revenue has grown.
When you look towards the future, are you planning any other expansion projects in this area to kind of meet the demand here? And what types of projects would you be looking at?
So again, we're looking seriously along with our colleagues through the Mayo Enterprise about what the best pathway would be in our emergency room. Certainly, we're also in the early phases of looking at, what sort of bed expansion should we have or could we have to the Eau Claire Hospital. Our surgical practice has grown significantly, so we're also sort of looking through what the mechanics and finances would be of expanding our number of operating rooms.
Thanks, Dr. Helmers. Dr. Hoerneman, could you talk a little bit about some of the expansion projects that you've taken in this area? I know you've mentioned a few of them, but how have you guys grown since these closures?
Yeah, we've had a number of things, as I highlighted a couple of those before, and then have a couple more things in the works. So we talked about expansion of our urgent care capacity, opening up those true urgent cares. We have seen our ER volumes increase, and we have an approved project to expand our emergency department at the Eau Claire campus to provide additional access there. There'll be some clinical decision unit beds there that will give some additional time for patients to have observation and then decide if they need more care in the hospital or if they can be discharged home. We are expanding our Lake Hallie campus, and so that will become an ambulatory hub where we'll have both primary care and specialty care, behavioral health. Our goal really is to keep patients in the ambulatory setting as much as we can, keep them healthy, keep them out of the hospital, and that's where we've seen the greatest need right now is additional ambulatory capacity. So that project is under planning right now and looking forward to having that open up. And then we're working towards looking at that pipeline of additional, the next generation of healthcare providers. So looking at our graduate medical education programs, we've got a long history of graduate medical education within the Marshfield Clinic. We've got a number of residencies and fellowships, and we're looking at expanding a primary care residency in the Eau Claire area. To meet that need, we know that that's a market that has significant demand for primary care, and we'll have that into the future. So we're looking to meet that need and work on that pipeline. Similarly, then working on creating that pipeline for staff. So how do we partner with some of the local educational institutions, some of the with the university, with the technical colleges, to make sure that that pipeline for staff is there because, having highly trained, highly skilled staff is a continued challenge, one that we focus on every day, making sure we got the right providers and the right staff to be able to provide the care we need for our patients.
Could you share a few more details about that residency program that you're looking at? I believe Preva Health had a similar residency that closed with their departure from
you're right.
Wisconsin.
Yeah, they did. Yeah, and as we talked about earlier, it had been such short notice that Prevea was leaving, and we did have some conversations about trying to continue that residency at that time, but there just wasn't enough time. The residents had already started to look for new positions, and so that residency ended up closing, and we just didn't have time to pick it up and put the pieces back together. But that opportunity still remains, and primary care is, I think, the first one to look at. But there's also opportunity for specialty residencies and fellowships there as we go along. So those that we're in the assessment phase right now, doing some financial planning around that, looking at the funding sources, but always keeping our eyes open for how we can keep that pipeline going.
And when it comes to that pipeline, can you talk a little bit about how many folks you've had to hire to kind of meet the demand in the area?
Yeah, I don't know if I have the exact number, but it has been a number of different staff and providers. We've seen an expansion in our primary care areas, so a number of primary care providers that have been added. We of course needed more staff to take care of OB patients. We do have Oak Leaf providers that are continuing to come in with their deliveries to our campus, and so that continues even to today. And then our urgent cares, we have hired additional providers there and staff to keep those open and make sure that the patients have access. So yeah, I don't have the exact number, but numerous.
When it comes to emergency care, Dr. Helmers had mentioned that they've had a few patients move to La Crosse. Are you also at capacity in this area and have patients have to go to other, Marshfield Clinic hospitals for emergency care?
Yeah, so I'm an emergency medicine physician, so this one is near and dear to me of making sure that, yeah, we are taking care of patients in the emergency department and keeping them local as much as we can. I would say that the capacity varies on a day-to-day basis. Most days we do have capacity to keep patients local, sometimes for an advanced procedure, tertiary care that the patients will be transferred. We've worked with our sister hospitals in the region, Ladysmith and Rice Lake, to have additional capacity there and keep patients in the region that way. So variable, but often we do have capacity to take the patients and make sure that patients are staying local.
Thanks, Dr. Hoerneman. Senator James. Oh, sorry. Actually, I'm going to go with Mike for a second, and I'll come to you, Senator. Sorry. Mike, the cooperative is working on using St. Joseph's, the closed HSHS hospital in Chippewa Falls, as an interim facility as it builds its own hospital in nearby Lake Haley. Could you talk a little bit about what services you're planning to provide at this interim facility?
Sure. It's interesting. We're 20 months in to this crisis, and people are looking at planning and trying to do some expansion. The cooperative is actually trying to do something about it by reopen beds quickly. People are still being seen in ambulance garages and shipped. It's like a crisis center still. Where's a bed? Where can we put people? We have an opportunity, and our plan is to reopen St. Joe's as a short-term interim facility in the fall. And we will be a full-service hospital. So we will have cancer care, OB, ER, surgical suites, and we welcome Aspirus to the community. And ER services are needed, but what the community also needs is a community hospital. People don't want to go to the ER and not be able to be treated there for an appendectomy or have to fly out of the area. And the hospital, as their CEO has said, it's part of their tuck-in strategy. We want to feed the network. And that's not what the Chippewa County and Chippewa Falls and Chippewa Valley need. We need capacity here to take care of patients. And that's what we're going to be providing in the cooperative hospital. So we will be a full-service community hospital next fall, and then work on building the new facility in Lake Haley. The other part of this that I want to talk about for a minute, we've worked with West Central Wisconsin Regional Planning Commission and the Wisconsin Economic Development Corporation. And the economic loss of these two hospital closures is 1,511 jobs per their analysis. And the ripple effect of the wages beyond the hospital wages and into the community is purchasing power and lost wages of $98 million a year, which translates to about $28 million in tax revenue. So we're bringing 300 jobs to the community when we reopen in the fall. And then at the Lake Haley site, we'll probably be in the 400 range. So we're trying to provide a substantial response that meets the community needs, that doesn't require people to leave the Chippewa Valley region, which as a population size, most of the residents' healthcare here should be able to be delivered in this community. They shouldn't have to be transferred to another hospital for things that can be done here locally. And that's the passion that's driven our board and our physicians who are lined up to join our medical staff. We have over 100 committed providers. And Jason mentioned recruiting physicians is tough, and that's going to have an impact on their expansion. Well, we have 100 committed physicians. What we need is the hospital open so they can have access to the care their patients need.
You mentioned plans to hire about 300 folks for the interim facility, followed by 400 for the Lake Hallie facility. How many folks do you have on board right now?
Oh, we have probably 20 to 30 working in various capacities. We don't have that much open. So the bulk of our hiring will be in the spring. And we're blessed to have some people that are working on a part-time and contract basis, experts in basically every hospital department. We have an IT team implementing Epic now and a lot of the infrastructure stuff that we need to get ready. And it's interesting, when we announced the acquisition of the former St. Joe's Hospital in early July, we put on our website an opportunity for people to, if they have an interest down the road, leave their name and contact information, their certification, what department, what job they're looking for. And even though we said we're not hiring, we're not going to be hiring until we get into 26, we have well over 700 people on that list. And from various messages of I want to come back, or I took a job out of town, but I want to come back to the area because I love Chippewa Valley. I'm working someplace else, but when you're ready. So we've gotten that question, particularly as we are going to financing and bankers, how are you going to fill all these spots? And that's been very gratifying and very, very confidence building for us that we're going to have the team in place when we're ready to bring them on board.
When it comes to financing, where are you with your fundraising efforts for this new facility, and how much more do you have to fill in that gap?
Well, we've raised between cash and pledges about $13 million, a little over $13 million. Most of that has come from philanthropy, local, and it's really been a kind of an internal campaign. We're just starting to go more public with that. We've had some grant support from WEDC, Wisconsin Economic Development Corporation. We've had grant support from Chippewa County to help us with some of the feasibility study. And we were happy that we were able to reopen the morgue when we took possession at St. Joe's for the county, saved them some dollars. And we've had some foundation support. So we've got a lot of balls in the air, so to speak, in terms of looking at funding. And we're confident that we'll have a combination of, if you will, equity, philanthropy, grant support, and some debt to get us started in the interim facility. Now, the good news in the short run is we're not building a new hospital at this time. So the capital investment is limited in the building beyond some renovations and things, and then equipment and IT, and then working capital to bring staff on. So we're off to a good start. We have more work to go, but we have many, many people throughout the community working actively on this every day.
Thanks, Mike. Senator James, you've introduced legislation that would provide funding for Rogers Behavioral Health to pursue a mental health campus in the region. Can you share details on that project and kind of where things are with it?
Yeah, absolutely. So this is what I call my miracle. Senator Bernier and I had worked on the original bill to expand mental health beds in our area in the Chippewa Valley, because we did have a mental health desert there. In my conversations with Senator Bernier, through all of this, we ended up meeting with Rogers Behavioral Health. And to be honest, I didn't even know about them until I got down here in the legislature. And then I also had some family experience hearing the name Rogers out of Oconomowoc. And I first met with them in April of this year, and then our first visit was June 12th of 2025 here. And it was during the budget process. And I point blank asked them, I said, would you guys be willing to look at the Chippewa Valley, bringing your services up to our area to help us out with the lack of mental health facilities and services that we have up there. Now, mind you, we do have awesome people in place already with North Lakes community clinics, the with their expansion services, and then Randall Therapeutic Services in Rice Lake. But we still needed more services for our area. And so when we visited June 12th, they did have a proposal available. And it caught me off guard a little bit, but we were prepared somewhat. And, there was some like, oh my gosh, this is a lot of money. Is this even possible? So we brought it forth, and it took my staff, who worked extremely hard on this, as well as myself, making the necessary phone calls to all of the colleagues on JFC and leadership, and saying this is an opportunity that we just can't pass up. And so with what Rogers is bringing to Chippewa County is that they're going to have a 3 facilities that will take care of general outpatient. They'll be able to serve 2 to 3 tracks of 60 to 80 people per track per year for general outpatient services. Then you go into the residential care center that would service 12 adults and 12 youth. And then we get into the crisis stabilization and observation care facility. And that would bring back some of our inpatient, mental health inpatient beds. It would be 7 adult and 7 youth beds. So Sacred Heart did have 8 youth mental health beds available for us, and Rogers is willing to bring 7 to our area, which is huge. So we're getting quite a bang for the dollars, and we were able to get that passed. It was part of the budget discussions, included in the budget, and then we passed the legislation recently. And then hopefully, we're talking about PRTFs in our state as well, and Rogers may be a partner in that moving forward, depending on how things look. So July 1st, I was contacted. So a matter of 19 days, we were able to get this as part of our inclusion in the budget. And it took a lot of work. I'm not going to lie. Down here, you have a lot of personalities to deal with, a lot of obstacles and hurdles to overcome. And I'm going to tell you, it was not easy. But when we finally got this across the line, in both the Assembly and the Senate, it's passed. We're just waiting for the governor to ask for it or send it over to the governor for signing. And then it'll go through, DHS would submit the 1310 for the 10 million to be released to Rogers. They're ready to go. They have the land. They have all the I's dotted and T's crossed. They're ready to rock and roll. So it's very exciting to be able to bring this back to the Chippewa Valley and just to see the progress of what this will bring. And I'm just blessed because we didn't have a Senate mental health and substance abuse prevention and we had children and families, but they added that to my committee, and that's what I chair down here, and that's where my passion is. And it's based on my own life experiences and my family life experiences, and to be able to do this and just help bring some substance back to our immediate Chippewa Valley area is so honoring, and I'm just blessed to do it.
Senator James, you've also worked on legislation to provide money to Lutheran Social Services to open the Libertas treatment, reopen. Well, the Libertas Treatment Center closed over there, and they'll reopen a substance use disorder treatment facility there with the dollars. Can you talk a little bit about that?
Yeah, that's even exciting. As a man of sobriety, in December, I'll celebrate 28 years of sobriety from drugs and alcohol. And I've had family and friends that were at that sought services through Ellie Phillips Libertas Center. I've transported people to Ellie Phillips because it was also our only detox center on our side of the state. So this one is the $1 million means more to me than what people even realize, considering what LSS is doing and just continuing being a partner across our state in so many services. But to open up this 50-man facility and have it available for those, because we have awesome services for our women. But for this to reopen, our women will still be treated in Eau Claire, but the men, and having these options and these sobriety services available if they want to achieve recovery and sobriety in their life, having this going forth. We had the construction groundbreaking in October, and I can't wait to see that place open up as well.
So Senator James, when in this the closures initially happened, there was legislation that was introduced to provide $15 million for emergency departments. The governor vetoed parts of that, and there was a legislative, stalemate over that for a while. That $15 million has now gone back into the general fund, I believe. What's your kind of assessment of that? Are you disappointed that money didn't move forward? What do you want additional dollars for this region as well?
So, everybody's going to have their opinion on this, and we tried our best, and the 15 million went back into the general fund. I'm going to remain professional here, but it was like beating my head against the wall on trying to get this allocated. We did legislation. We were trying to make sure we did it proper. We tried to honor everybody back at home, what we were hearing and what the needs were to meet those needs. The whole reality is $15 million does not go very far when it comes to the whole breadth of services that everybody wanted this $15 million to cover. Our intent was to open up, and keep in mind, the original $15 million was supposed to be for mental health in the Chippewa Valley. So everybody needs to know that first. And we got it in the budget, and then obviously the issues with HSHS happened. We had conversations with them. It wasn't going well. As a cop, I was getting the red flags. I got the hair standing on the back of my neck, and we knew that there's going to be some issues coming. I just did not feel comfortable. But we brought forth the legislation, and we tried to pick the number one area that we were hearing, and we're still, we're hearing it still. Kudos to all the entities that have absorbed the issues that we faced in the Chippewa Valley. But the ER, I'm dealing with it with my dad still. The ER is an issue that still continues to this day. And that's why we try to get the 15 million for the emergency room area. But every chance I voted with my Democrat colleagues on this. We tried to get it back to the Chippewa Valley, but there's just issues down here in people's politics get in the way of things. So that really devastated us when we couldn't get that through. The governor ended up changing the scope of the language of the legislation. He took out the emergency department part and used it for hospital services grants. And that really, so it was able to be used in multiple counties and for multiple services. And again, my mindset, I'm the keep it simple, stupid legislator. KISS method really works for me. And I'm like, how far can $15 million really go? So we tried to keep it in there. JFC, after the governor took his actions, there was so many Supreme Court legal cases going on. We just didn't have the avenue. JFC did not feel comfortable releasing the funds based on what they were hearing from the Ledge Council, and they provided a statement saying it could open the door for some legal implications. And I'm sorry, but when you hear stuff like that, it was not a comforting feeling. But, that's in all respect, that's in the past. I'm move forward kind of guy. Let's keep this going. We got good things happening in the Chippewa Valley. If there's anything that I can do moving forward to help our entities back at home, I will definitely look at it and I will pursue it.
Thanks, Senator James. My apologies, Senator Smith. I'm taking a little bit of time to get back to you. Could you talk a little bit about your assessment of the state's response to this? What would you like to have seen?
Well, we would have liked to have seen that $15 million used because it, even though, it wasn't going to build a new hospital, it wasn't even going to build a new emergency center. It was actually just to alleviate some of the pressures that we explained at the very beginning of this conversation. And that's why it needed to be actually opened up to, for instance, Rice Lake or Menominee or any of these other facilities that might have alleviated the problems that we were having with providing those services to all of our patients who were having to move and find other places to birth, for instance, or wherever they had to go. But that is a history. And Senator James is right. It's behind us now. Even though Joint Finance Committee played games with that, and I know that Senator James was up against that because it's his majority party that has been really difficult to work with under these circumstances. And we're going to move on. I had actually proposed a couple of things. One in the budget, $100 million. Service, what do I want to say? $100 million for a hospital closure stabilization fund. It didn't make the cut as well but again, from the lessons we just learned, I now believe that that's something we really need to have in the state so that we aren't faced with this situation with the next hospital closures that may happen around the state. Because this isn't going to be the last. I think you all probably will agree that if under the circumstances of where we are these days, there's very strong possibilities it could happen again. So I think we have to be ready to support our communities when it happens and wherever they may be. So there was that. And of course, we just passed a budget that included that $1 million for LSS, and I'm so really pleased that we were able to vote yes on that. And Senator James is really telling you the truth about how important that always has been to our community in the Chippewa Valley to help patients who needed that services. And the $10 million for Rogers, well, let's hope that really does become a really stable situation for patients who need that as well. And we, again, moving forward, we have to come together and work together to make sure that this sort of situation does not get politicized as much as this last one did, and we are able to actually do our job here in Madison and move those funds as quickly as possible in the direction that they need to be moved in.
Senator Smith, you voted for the budget, which also includes a substantial increase for hospital Medicaid payments. Can you talk a little bit about does that help address this scenario you laid out about making sure that we can prevent future hospital closures in the state? And what else would you like to see done to prevent a similar situation from happening?
Well, absolutely, and that is what our backs were up against the wall, because if we had waited beyond when the big ugly bill had been signed on July 4th, we would have lost our ability to raise those funds so that the 1.1, I think 1.1 billion, maybe 1.2 billion that we're going to see come into the state of Wisconsin because we passed the budget when we did and how we did. And I know that everybody on this call is grateful for that we were able to do that. I think it is going to stabilize the Medicaid funding that comes into the state to some degree, and a huge effort on all of our parts to make sure that happened. And it is unfortunate, though, that it happened to be in a situation that we were in, that we had rushed to be able to have to do this, and something got missed, including my hospital stabilization fund that I think would have been also a helpful thing. So to move forward, Sean, again, we can't let politics get in the way of our healthcare and access to healthcare. And hopefully there's a lot of lessons we've learned through this experience that we have experienced here in Chippewa Valley. and we're able to pick up the pieces from that and make sure that much of this doesn't happen again. And I applaud Aspirus and what's happening with the Chippewa Valley Cooperative as well, and coming in and plugging the holes where they can. But hopefully everyone is patient enough within our Chippewa Valley to realize that none of this is going to happen overnight. Honestly, and I've grown up here, and Sacred Heart Hospital, where it's located, it is an unfortunate thing that had happened, because here's this building, this 10-story building that sits there empty in everybody's view. It is like the most visual sight of what's wrong with our health system every day that people have to drive by it. And I think that's what makes people really impatient and hard for them to understand why we're not just reopening that hospital. And I applaud our doctors here and our experts here that are able to help try to explain that that is just not how it works, and that we're gonna actually be in a better place in the future with what they're doing to make sure that we are providing healthcare services to everybody.
Thanks, Senator Smith. So we're fast running out of time here. I guess, kind of as a wrap-up question for everyone to kind of weigh in on, can you talk about maybe like one thing that you would either like to see policymakers do, or one thing that could help further your efforts to meet these healthcare needs in the Chippewa Valley? And Senator Smith, why don't you give us a start?
That's a loaded question, John. What would I like to see? I'd like to see some changes made, in fact, in the ability of us as policymakers to not have to go through what we just went through with a joint finance committee that really wasn't willing to do what needed to be done to move money when it was right there in front of us. So I guess policy-wise, I really want to see us address this, because I would be even willing to send you by email if necessary, a list of 10 occasions where the Joint Finance Committee did exactly what the 1013 to move money when they were asked to, exactly the same similar circumstances that they were asked to do with this money, and then they made the claim that they couldn't do it legally, because it was politics. Politics got in the way, and so I hope on that perspective that we are able to make some changes in this body so that that doesn't happen again. And I just can't say that enough. So we will continue to hopefully work together and provide the policies that help people access healthcare. You could see this was the reason that the closure of government over the previous 40 days that we went through on a federal side, that we have a bigger issue than just what's happening here in the Chippewa Valley, and it's going to have to be solved somehow.
Thanks, Senator Smith. Senator James, what would be one thing that you'd like to see done to help this situation?
Well, yeah, there's so many things, but I think being engaged with our public, they need to reach out to us, and even the professionals on the panel here today. If they have ideas, we need to hear them. And I know, and I don't care what the ideas are, I don't care if they're repeated ideas, but we need to continue to hear these. And it gets very difficult because I'm my dad's POA right now for his healthcare and finances. And I thought I had a pretty good uphand on the situation with our, we're talking about the silver tsunami that's coming, and it is devastating with truly what I do know and what I don't know. And we need to be able to educate our public when it comes to these types of healthcare issues and emergencies that we get put under. We need to have more education and opportunities to learn from professionals and help guiding us through these issues, because I have to go through the Medicare process with my dad again. And me and my wife, we got in a fight about it last year when we did it, and it was very frustrating. And I'm like, if I'm at my age right now, I'm 53. My dad's 74. And what are our elderly going through if I'm going through this at 53? So I think there's some things that we need to improve on in getting the help for not only our elderly aging parents, but even for us as the caregivers as we navigate through all this.
Thanks, Senator James. Jason, what's one thing that could help you guys open up there?
Well, I mean, to respond to that, there's two things that come to mind right away. One is access to Medicaid for our population. I know that that's reducing into the future, and so anything the state can do for that would be beneficial, as well as work around prior authorizations and denials, frivolous denials, if you will, that delay care, make care even more expensive. And it would really help us as you look at Aspire strategy, and this was a little bit of a response to Mike as well, is that Aspire strategy is not to move all the patients from the outside hospitals to the tertiary center. It's actually the exact opposite. Aspire strategy is to keep as many patients locally as possible. I oversee Medford and Stanley. Both of them are close to full right now. And the reason we do that is it's the best care for the patient. We want the patient close to home. That gives them the best care and provides the best experience for the patient. And two, our beds are full. We're close to capacity at many of our tertiary centers. To build extra beds, it's hundreds of millions of dollars. And so the best care is locally. So as I think about the Chippewa Falls Hospital that we're building, we want to keep patients there locally and close to home. And so they need access to Medicaid, and we need prior auth denial work so that that hospital gets reimbursed appropriately so that it can stay in business long term. Because we want it there long term, and we want to expand it, and we want to keep the patients close to home. So that work that the state can do can help all the hospitals across Wisconsin stay open and in business.
Thanks, Jason. Dr. Helmers, what's one thing that could help?
Well, I would just, thank everybody for these sorts of communication sessions because I think it's good for people in the state to understand the issues, and I just want to just have people understand that the different entities in the community are working together. Dr. Hoerneman and I are in somewhat regular communication, and we've worked together through this, and just the recognition of that as well.
Thanks, Dr. Helmers. What about you, Dr. Hoerneman?
Yeah, similarly appreciate the collaboration and making sure that we're all doing the best we can to cover the needs. And then also very thankful for the support at the state level on those Medicaid reimbursement rates. Those really are important to the sustainability when we're trying to provide those safety net services. So that was a big accomplishment by the state. Hopefully we can get that through now at the CMS level and we see that come back to us.
Thanks. And Mike, we'll give you the last word.
Oh, last word. All right. We could have a long list of discussion about policies and things. I think what we all need to remember, whether it's healthcare, politics, or other things, at the core of it is our patients and families trying to deal with their lives. And Senator James hit on some of those things that are very real to all of us in the communities we serve. And healthcare should be a collaborative activity, and as should politics. So that would be my one wish. If we can work more together to solve community problems. Remember, that's what we're here for, to serve the community.
Thanks, Mike. And thanks, everyone, for participating. Thanks for attending. I appreciate going over a little bit here. Our next event will be a hospital CEO roundtable in Madison next month. Hope to see you there. And again, thank you all for participating and attending.